Well, my name is Tanya Pietilainen. Oops. And I'm going to talk to you about considerations I made when creating surveys for a fundraising event at a community organization. So the organization at which I completed my practicum is called l'Association des Personnes Handicapées Intellectuelles des Laurentides, which I translated as the Association for Persons with Intellectual Disabilities, also abbreviated as AFIL. So the organization is located in Laurentians in Quebec. So to put you in context, the organization serves people with intellectual disabilities who do have basic communication skills and are able to perform daily activities of living, such as eating or toileting. And my role was to assist in the preparation phase of this annual fundraising event, which actually takes place next week. And it's a spaghetti dinner, or spaghetti lunch. Basically, it takes 2 full days. And last year alone, the organization raised $16,000 with this event. And basically, I kept track of donations. I was responsible for updating documents and publicities. But for this presentation, I'm going to focus on the creation of surveys. My practicum-based case lies on the challenge that the staff members basically don't update the preparation phase or the event itself from one year to the next, and they lack the time. So this implies that the event itself, although successful, doesn't change at all from one year to the next. And as a result, I crafted surveys to evaluate the event by collecting basic guest demographics and feedback from clients and volunteers to collect data in order to make changes. So ultimately, the survey is an evaluation tool, and the findings act as a knowledge production tool. The questions themselves are meant to meet the needs of the organization and will help collect significant data from local stakeholders. For instance, guests are asked about how they were informed about the event and where they're from to measure the efforts of publicity, and about their satisfaction. Volunteers are asked about the relationships with other volunteers or staff, about whether they felt that their role was meaningful, if they received sufficient training, and if the organizers were considerate of their needs. And finally, everyone's invited to provide basic feedback at the end. So the data collected will allow the staff to gain an alternative perspective about the quality of the event, and will allow them to apply these evidence-based findings in their decision-making process when considering improvements for the following year. When crafting the surveys, specifically for the satisfaction portions, I included a Likert scale. I used 1 idea per question, simple wording, and a balanced number of positive and negative responses. So the potential drawbacks are that the survey is only available in person at the days of the event. In addition, the font may appear small for persons with impaired vision, and many people with intellectual disabilities won't be able to participate in the survey. So to address this last important issue, I suggested to train the volunteers to ask the members in person and collect the results, or basically that they're going to be asked at a later date when attending the organization, as many attend the organization on a weekly basis. And lastly, there's always a risk of obtaining a variety of incoherent feedback, which would make it very difficult to make actual evidence-based conclusions. Finally, so throughout this practicum-based case in the presentation, competencies that were alluded to were communication, program evaluation, analysis and critical thinking, and the facilitation of health literacy, and knowledge translation. So finally, the values that were used during my practicum were critical analysis, drawing on principles of social justice and critical thinking, and equity, diversity and cultural safety, and partnerships with populations served. So basically, I reasoned that surveys encourage social justice and freedom of speech for all the members of the community, regardless of gender, socioeconomic status, type of employment, and will also be inclusive to the people with the disabilities. Lastly, the data will be critically analyzed and will hopefully provide reasoning for creating positive changes that are both equitable and culturally safe. And finally, the partnerships between the organization staff and the people served are demonstrated based on the premise that feedback from the community will be sought and valued in order to create changes. And furthermore, the partnership is demonstrated by the support from members of the community by donating their time to provide that feedback. So by doing so, they basically show that they care about the financial success of the fundraising event.
So, any questions for Tanya? Scanning the room. I feel like the You know, that thing that bops back and forth. I'll ask you one. So you were trying to make the survey more user-friendly for particular populations.
Well, basically, they didn't evaluate their event at all.
Oh, okay. So you had to design a survey.
Correct. Yeah, I just designed it. Yeah.
All right. Did you have a look at any of the tools that are out there that use visual analogs or basically pictures for folks who don't have either English as a first language or who have trouble reading, so that they can actually complete surveys on their own, sometimes with assistance, but often on their own, because pictures are used instead of words. Did you have any look at those tools?
To be honest, not really, because basically, although the community of persons with disabilities is very important when collecting the feedback, because basically the money that's raised goes for their benefit anyways, there's about probably 70 members, whereas there's 2,000 people about that come to the event. And their main focus was kind of like to keep it short so that people want to do it, because if it's long, they'll just be like, oh, too many questions and throw it out type thing.
Yeah. Got it. Yeah. And I guess the other question, I heard a couple of people go, wow, when you talked about the spaghetti dinner and how much money was raised. What kind of spaghetti got served?
Yeah, so basically it's over the course of 2 days, from 11 a.m. to 7 p.m. And they do probably like 700 deliveries and 1,000 people that come in.
Wow, that's pretty amazing. That's quite the fundraising. Thank you. Unless anybody else had any questions. I wasn't seeing any hands. Okay, all right, thank you very much.